we hear the word global health, we imagine something like the health in different regions of the world, or what the health of each existing country or continent is like. But in really, global health is not only in charge of that. It's also in charge of disseminating and exposing the different risks and solutions in each country through different organizations, such as the WHO, which is the best known. In this video, we will talk about different aspects such as cultural, socioeconomic, political, and we will start talking about the cultural part. Although it may not sound like it, culture greatly influences global health in this because some tribes or people distributed in each country have different beliefs about how to cure diseases, from using things that should not be put on ones to things that should not even be consumed.
A close example can be found what is in our country, Mexico, where in certain indigenous people some forms of traditional healing are still preserved, such as the use of medicinal herbs on wounds or for diseases, or also the belief that the spirit is being tormented and is the cause of the diseases that occur. Another example could be the existing tribes in African countries where health can be considered bad or poor due to the lack of these services. Due to this, the inhabitants of these countries have to resort to ways that the ancestors used to heal as rituals came, which is something highly respected in their culture and it means a lot for them. The independent culture of each country affects its health in positive and negative ways. Since just as some of the ways of healing are good, there are some methods that can become questionable due to their poor health or because they are dangerous, such as the ingestion of foods not suitable for human consumption. Now this part clarified, we continue the video in the hands of our colleagues who will continue with more information.
Of public health policies to the allocation of resources for health care systems. Political decisions have a direct impact on a wide range of health problems. Some positive points we can highlight about the influence of politics on global health are some governments enact policies to encourage vaccinations, proper nutrition, access to clean water, and disease prevention, as well as to expand communication between nations to address health problems such as the case of the COVID pandemic. And last but not least, governments have allowed to improve health systems in certain regions, as in the investment in the medical infrastructure and improvement of health care service. But in all this, there are also negative points such as the poor distribution of our resources for the certain group of people, mainly those with a low resources, the conflicts that are generated between nations, with also an impediment to access to basic resources necessary to have a suitable quality of life, as is the case of the conflict between nations that takes place in Israel and Palestine. And finally, the commercial influence that politics has opened wide due to industrialization, such as the production of canned and unhealthy products, actions that affect global health.
The law to the highest attainable standard of physical and mental health is enshrined in several international legal instruments, such as international covenant on economic, social, and cultural laws, which encompasses freedoms and entitlements. Freedoms include the allows individuals to control their health and body and to be free from interference. Laws include the laws to access quality health services without discrimination of any kind. A human laws based approach to health commits countries to develop health systems that are human laws compliant, effective, gender-sensitive, integrated, and accountable, and to put in place other public health measures that improve the underlying determinants of health, such as access to water and sanitation. This means that countries must ensure that health laws, policies, and programs respect and promote the realization of human laws. The research showed that proactive measures to fulfill human laws obligations helps countries improve substantive equality and increase the resilience to crises. For example, applying human laws from work to reproductive health can help us determine the extent to which preventable maternal mortality and morbidity are the result of the multiple violations of human law.
The economy, driver or barrier to global health. The relationship between the economy and global health is crucial and complex. Let's examine how economic dynamics influence health on a global scale. Purchasing power and access to healthcare. People's economic situation influences their ability to access necessary medical care. The gap between rich and poor creates disparities in access to health services, impacting global health by perpetuating inequality in access to healthcare. Economic crisis and public health. Economic crisis can have devastating effects on public health. Decreased financial resources can lead to cuts in health services and prevention programs, exacerbating existing health problems and creating new challenges. Social inequalities and determinants of health. Social inequalities, including the unequal distribution of economic resources, have a significant impact on the health of populations. People with lower incomes face higher risk of illness and premature death due to lack of access to adequate health services and other social determinants of health.
Investment in infrastructure of health. Investment in health infrastructure is essential to ensure that everyone has access to quality health care. Without adequate funding, health systems can become overstretched and unable to meet the needs of the population. Intervention strategies. Implementing health-first economic policies can improve global health outcomes. Investment in health not only improves people's quality of life, but also contributes to sustainable development and economic growth. Impact of economic globalization. Economic globalization can have both positive and negative impacts of global health. Collaboration between countries is essential to address health challenges in an interconnected world, such as the spread of the infectious diseases and drug resistance. Innovation and medical advances. Research and development in the field of health depends largely on economic investment. Fostering innovation can lead to significant advances in the prevention, diagnosis, and the treatment of diseases, benefiting global health as a whole. In conclusion, global health is a complex fabric where political, cultural, legal, and economic traits converge. These elements intertwine to form the tapestry of global health, determining who has access to healthcare, what health practices are accepted, and what resources are available. Only by weaving together these diverse aspects can we a vibrant and equitable global health canvas for all people around the world.